we want to turn our focus once again to the overall COVID situation in the country. Now, the Indian Public Health Association has, in a statement, it's a lengthy one, made a couple of key points about COVID, and we're joined by one of the authors, Dr. Puneet Mishra. He is a professor at the All India Institute of Medical Sciences. He joins me now. Before I come to you, Professor Mishra, let me just read out 2 or 3 points which we can focus on. Now, the report says that it's unrealistic to expect that COVID-19 pandemic can be eliminated at this stage, given that community transmission is already well established across large sections or subpopulations in the country. So, sir, in our cities, for example, Delhi or Mumbai, would you say it's out there, and that despite all the containment efforts, it's well into people, any number of people, and we just don't know what the source is? Is that the stage we are at?
As far as we are talking about this joint statement, what we have said about the community transmission, India is a very heterogeneous country, and in different part of, the epidemic is evolving in different stages. If you talk about certain areas in Delhi or Mumbai, yes, definitely there is some kind of, community transmission is there. And what I was going through a paper which I have downloaded today. It has been published by recently by DG ICMR, Dr. Balram Bhargava. And what I see in this paper, that they could not classify around 44% of positive cases in any of the defined category. They have predefined 6 categories in which they should, the cases from where they were taking the samples, and the data, it pertains up to 30th of April. And what it says that out of 40,000 cases, there are more than 17,700 cases for which they could not specify from where they are coming. So this is one evidence. If you say the other thing is, of course, when we talk about the community-based transmission, the gold standard is the zero surveillance. Since we do not have any credible data, at least in the public domain, so we don't know what is the situation of the zero surveillance data. The other point which comes, which I will like to mention, there was a tweet a few days ago from the Principal Secretary of Bihar. And I have just seen the screenshot of that tweet where he has published a report where the migrant workers who have gone to Bihar from different parts of the country, from Delhi, Mumbai, yes, and other parts, they said that around 25% of the people who were from Delhi, they were positive for COVID. So what does it indicate?
Besides these, and this is a worst case scenario. Right, so it's well in the community, not just in our cities, but what you're indicating is that because of travel, and you can't deny travel, and migrants have every business to get back to their homes, it's going to spread, right?
Probably, if migrants, they are going with this disease, many of them, they might be asymptomatic, right? If they are detected, they are isolated, well. But if they are not being isolated or asymptomatic and they are going to the community, they are transmitting the disease, and they would be transmitting the disease. So
one final question, Professor Mishra. People flying, yes, there have already been COVID positive cases. I'm not suggesting that people pick up the infection on the flight, but people who have picked up the infection may have been asymptomatic. They land, they come up with symptoms, because in some states they may be quarantined or home quarantined, right? So the spread is happening now.
Yeah, I mean, definitely spread can happen by that way. That's why what we are saying, that now we have to live with this virus for quite some time. So we have to take all the precautions. And probably the purpose of, the prolonged lockdown and all those things was to make people aware about the thing and to increase our preparedness and to make people aware about taking the steps like social distancing, using the face mask, and frequent washing of hands. So with certain precautions, we can, limit the spread of disease, but totally, I don't think we can eliminate the danger of spreading the disease through.
Right, Dr. Mishra. I think that point comes across loud and clear, that perhaps the worst has not yet come in India. But thanks very much, sir, for being with us with those details.